Hello everyone, it's DrCary Yurkiw and welcome to our webinar today on hip pain. I started practicing chiropractic over 26 years ago, and originally I'm from Winnipeg and went to school in Toronto at the Canadian Memorial Chiropractic College. I saw a chiropractor when I was young for knee pain, and that really made a big difference because the chiropractor assessed my knees, did x-rays, and then did treatment to help my knees to function better. I've started a new practice. It's in Kelowna, British Columbia, and we have flexible hours. We're open on weekends. Today we're going to talk about hip and SI pain, which is the sacro-iliac joint right in this area here. Where does hip pain come from? Well, hip pain comes from injury to the joint. It can come from poor posture and alignment, from wear and tear in the area, or inflammation in the joint. For SI pain, where does that come from? It comes from the lower part of the spine off to the side where there's a little bump sticking out called the PSIS. That's that bump area. It's a sharp pain in that joint and makes it hard to stand and go upstairs. And it's very localized to that one joint and then the surrounding area around it. The anatomy and physiology of the area, there's a ball and socket joint, which is the true hip joint right here. It's cartilage at the end of the bone. There's fluid in between the bones to help the bones to move freely and easily. There's muscles around the area, tendons that connect the muscles to the bone, ligaments holding the bones together, and then bursa or sacs of fluid that protect the muscle from rubbing against the bone. What are some common conditions we see? Well, we see a lot of sprains and strains of the sacro-iliac and the hip joint. Sometimes they come from sports injuries or falls or slips on the ice, slips on water. We see ligaments that get strained, muscles and tendons that are sprained and strained. And sometimes the nerves are affected, like the sciatic nerve that's passing through that area. What are some other common conditions? Well, arthritis is a common condition. And primarily we see osteoarthritis, which is a wear and tear of the joint. It wears unevenly due to the amount of pressure being put on it, and if there's been some trauma to the joint. We also see rheumatoid arthritis, which is more of a systemic arthritis affecting many joints in the body. And then psoriatic arthritis, which is associated with psoriasis. Other conditions that we see in the clinic are bursitis, which is friction and inflammation of the sac of fluid that protects the muscles from rubbing against the bone. And when the bursa gets inflamed, it can be quite painful, especially moving in certain directions or sometimes even at rest. Like if you're trying to sleep at night, some people will wake up with some pain in the bursa area. The activities that are most affected by hip and sacroiliac problems are walking, going up and down stairs, getting into the car and out of the car, and then lying down, especially on the side that's affected. Posture and alignment affect the hip and the sacroiliac because with poor posture, it can put more pressure on one side than the other. We assess posture front to back and side to side. We also check the low back for hip conditions and the knees because they are the joints above and below the hip in the kinetic chain. And then we check the feet too because we want to see if there's improper footwear, improper posture of the feet. If the feet are turning in or outward, it can affect the hips as well. So what can be done to help? We do a history, then we do an assessment on the hip area. We diagnose that and then do a treatment. We restore the function of the hip and the alignment of the hip area. We give advice as far as what people should do at home, including exercises and stretches, and then we follow up. We also recommend lifestyle changes. That could be postural changes, yoga and stretching, nutritional changes to help the healing process, weight management, and weight distribution on the joints. stress, because stress can be pro-inflammatory, exercise, and shoe wear. If you do have hip pain, you can call or message our office. We are accepting new patients, and usually we can get a new patient in within 48 hours. Our phone number is 250-486-0062. Our address, 105 1628 Dixon, and our email address, DrCary Yurkiw@gmail.com. For social media, our handles are DrCary Yurkiw on YouTube. We have a podcast called Super Healthy. You can get that on Apple Podcasts, on Spotify, and Google Podcasts as well. And on Facebook, it's the same handle, DrCary Yurkiw, on Facebook, Instagram, and Twitter. If you want to go to our website, it's www.caryyurkiw.com. I do have a book that was published on Amazon last year. It's called Back Pain. Just have to type that in and then my name, DrCary Yurkiw. You'll be able to find that. It's in print, so you can get paperback. It is as on ebook, and it's also on audio format on Audible. If you want to join us for events, we have a number of webinars coming up. You just have to go to eventbrite.ca, type in Yurkiw Chiropractic, DrCary Yurkiw. You'll be able to find the upcoming events. We've been doing a lot of them through Zoom, but now we're starting to do more events on Facebook Live like this one. If you want to take advantage of our special offer today, we are offering an initial consultation. It's good for a 15-minute consultation, and it's good until October the 29th, so you have a week to use that. The code is hip pain, and then you can call this number to book that appointment, and it's for people in the Kelowna area. I want to thank you for joining us today. Please follow our page so you can get notifications of upcoming events. And then we look forward to seeing you in the clinics.